Let's go. Perfect. Thank you. So, welcome everyone to our Friday session. So, mental health for healthcare professionals and tips and tricks. So, I'm Daisy. We also have Alyssa, Jen, Tori, and Chelsea here with us today. We'll be talking with you guys about some statistics, a little bit of background, and then also, again, tips and tricks, and then things that the career services specifically can do for you to help you. So right now, I'm actually showing the QR check-in code on the screen. So if you can go ahead and you pull out your phone, check in for the event, it just helps us to have a record. While you do that, I do want to let you know about our access and accommodations policy. So your experience here at Southern New Hampshire University is important to us as our policy and practice to create an inclusive and accessible learning environment. If there are aspects of this presentation's design or delivery that present barriers to accessibility, depending on where you are, please notify the Online Accessibility Center if you're an online student. You can email oac@snhu.edu or by phone at 866-305-9430. If you're a campus student, you'll contact the Campus Accessibility Center by emailing cac@snhu.edu or by phone at 603-644-3118. If you're staff or faculty, you can contact the Human Resources offices by emailing hr@snhu.edu. So now what I'll do is actually pass it over to Tori. Tori's going to go ahead and lead us through a quick meditation and intention setting. So Tori, take it away.
Thank you. Welcome, everybody, to this wonderful presentation. I'm going to get us started. So I'm a career advisor here at the university, as well as a yoga and meditation instructor. So we are going to do just a short guided meditation, and I'm going to focus on energy. So just creating some energy throughout yourself, no matter what's going on throughout the day, what's already happened, or what's about to happen. So we can get ready for this awesome presentation. So wherever you are, if you want, I will ask you to close your eyes if that is comfortable to you. You do not have to. Again, just doing what you need to do. If you're new to meditation, you can simply listen. But I ask that you stay open and just come with me. So I'm going to close my eyes here, as it always helps me tune in a little bit more. And you're just going to start to focus on your natural breath. So not controlling the breath at all, but just your natural inhales and exhales. So take just a couple minutes to do that. And as you're doing this, it's nice to kind of reflect on what's going on with your breath. Are you taking short, shallow breaths? Are you taking long, deep breaths? Or maybe you're even holding your breath, right? So starting to increase our inhales and exhales if they're shallow breaths that we've observed. And then as you continue to breathe, we're not going to do too much controlling of the breath today. I want you to think about your inhaling energy, right? Inhaling energizing oxygen into the mind, your body. And then as you exhale, you are getting rid of something that doesn't serve you, right? So that could be a feeling, an emotion, your mood, a current thought, or a thought that's going in and out at certain times. So don't have to think too hard about it. Just inhale that energizing oxygen and then exhale something that you don't need anymore. You can start to exhale through the mouth if that feels good. Inhale through the nose. Exhale, let it go through the mouth. So if it helps you to do a little bit of a visualization, something I like to visualize for energy is sunshine. So sunshine just kind of coming down onto my skin. I'm outside somewhere. So take yourself to a place where you can feel relaxed there for sure, but definitely still gives you that energy that you're looking for at this moment. And always continuing the breath. That's the one constant here. And keep inhaling and exhaling. And maybe you're on a beach or in the woods or in your favorite room, whatever works for you. You're inhaling whatever energizes you. It's different for everyone. And then I want you to Set an intention for today's presentation. That could be you simply want to learn about the tips and tricks. Or maybe you're here to, help others or help yourself. Whatever that intention is, it's not something you have to share unless you want to. It's for you and only you. And just focus on that. Just bring it into the meditation. Bring it into the breath. So now you're inhaling good energizing oxygen, exhaling what you don't need. Maybe you're visualizing something that brings you energy, and maybe you have placed yourself somewhere that feels good to you. And now you have a set intention. So throughout the presentation, if you find yourself a little distracted or you need to kind of come back to what's going on, you've lost your train of thought, that's okay. Come back to your breath to help calm you down. The longer inhales and longer exhales that we have, the more that will calm our nervous system. So it's always something you can come back to, which I love. We'll be here for another minute or so, and I'm going to just go silent to let you guys fully immerse yourself in the end of the meditation before we get on to the presentation. So continuing your inhales and exhales and visualizing wherever you are. Keeping your eyes closed if they are closed, and breathing still. If you're sitting down or standing up, you might just want to shake your arms, your legs, just get some energizing movement throughout the body. Roll around your wrists, stretch out your fingers. And then for our last big inhale and exhale, if you have the room, I want you to take your arms out and up as you inhale, so reach for the sky. And then as you exhale, bring your hands together down into heart center. Completely let it go. You can slowly start to open the eyes. And it was an honor to guide you before the presentation starts. And now I will turn it back over to the group. Thank you, guys.
Thank you, Tori. I love those. It's a reminder for me to breathe throughout the day, which I don't think I really do enough of outside of the basics, obviously. Perfect. So with that, we're going to go ahead and switch over to a quick poll. There are voting instructions on the screen, but you can do it with your internet browser or with your phone. I'm going to go ahead and use my phone. I feel like it's a little bit easier. And if you can just, if you're comfortable, go ahead and vote on the questions that we have here, and we will see what answers we get. Perfect. I always love watching Poll Everywhere actually work. It always feels like a small miracle. And I'll give it a few minutes, obviously no pressure to answer, but it's just I think a good way to check in with yourself as well, just to kind of see how you're feeling and compared to others perhaps as well. Perfect. Okay. So it looks like a pretty even split between anxiety and stress, which truthfully doesn't surprise me. I think that kind of fits the world today. So it is what it is. And then, okay, so yeah, a couple of votes for loneliness. All right, awesome. Thank you for going through that with me. And what I would like to do now is, oh, that's right. Go ahead and cover some basics with you guys, a little bit of background. Obviously we're aware, 2 or so years ago, I guess actually it was 2 years last month, the world completely changed. And within that scope, there's been several, surveys and studies about the mental health of everyone, but then especially when it relates to people who are in healthcare in any description. So the Mental Health America organization ran a survey, and I found the results of it surprising and not, right? So out of the 1,000 plus healthcare workers that they checked in with, they indicated that they are stretched too thin, they're stressed, they're worried about exposing loved ones to COVID, emotionally and physically exhausted, not getting enough emotional support, and struggling with parenting. The parenting is actually particularly interesting to me. I imagine it being difficult with the hours and trying to get care. So just as a kind of a litmus test, I guess, of where other healthcare workers feel that they are right now, or where they were, I guess, even a little while ago. Perfect. So with that in mind, it's become more apparent that being able to support people in their mental health journey and also support yourself in your mental health journey is paramount, especially through the lens of COVID and healthcare workers. So why is there such this disconnect between it's just not happening? So a part of that is because healthcare workers are often, trained or taught or just are the sorts of people where they put others first. They're fixers and doers and helpers, and they're not used to turning that lens on themselves. The easy joke here is that the carpenter's house is always broken. So a healthcare worker, do they go to the doctor? Do they go to a mental health practitioner? So within that same vein, self-care is not prioritized necessarily. There's fear of judgment from others. I think that a lot of even the verbiage around healthcare workers over the past 2 years has been that there's these Herculean efforts and that they're heroes. And is there a perception that heroes don't need to worry about their mental health, and is that an okay perception? So what does self-care practice involve? So it's self-awareness, self-compassion, and I love that one, self-compassion. And a variety of other things. So, within your own social circle, within, yourself as well. And within a study of Australian doctors and nurses, 100% of them found that self-care plans helps their mental health. So with all that in mind, what can you do? So there's, big picture and small picture things, right? So, kind of at the 3,000-foot level, self-care and self-compassion techniques. So, and again, I love that one, self-compassion. So being forgiving of yourself, allowing yourself to feel what you feel, which is actually the next one. So to validate any emotions that you're feeling, and because they're okay. So it's just a part of the process. We can't help what we feel. So developing coping strategies, getting support from team members, developing a buddy system. Maybe you have a friend who understands and you guys can kind of go off of each other, whatever that looks like. Connecting with others, recognizing the impact of social distancing on your well-being, making time to unwind, like that detox time. It's not just go, go, go. You need time to kind of be with yourself and your feelings and kind of wind down. So potentially limiting social media exposure may also help you, but also just taking care of your body, like eating good food, drinking water, going on a walk, like even just little self-care things are enough. Maybe it's a bath bomb, like whatever does it for you. And then finally, to recognize the role that you play and the difference that you make. I think that's really important as well. Perfect. So with that, I'm going to go ahead and pass it over to Alyssa, and she'll take this slide.
Thanks, Daisy. Hi, everybody. My name is Alyssa, and I sit on the career services team here at SNHU. And so I'm just going to go ahead and share some helpful support resources. So just, of course, as Daisy had kind of mentioned earlier in some of the slides, personal and emotional problems are really a normal part of life. A student who has, many strengths and abilities may experience difficulties that might, or that could effectively be resolved through counseling services. And so the counseling services offered here at SNHU are available for both online and campus students, and they offer professional trained staff to assist students in coping with problem areas in their life that might interfere with maximizing their college and life potential. So the services really provided by the counseling service staff are confidential and include individual and group counseling, also referrals to other resources, crisis assessments, consultations, educational programs, and even educational videos. So I'll go ahead and just post a few of the links here in the chat box as well. So you guys can go ahead and take a look at some of those details for yourself. So it should be pasting here. Hopefully everyone can see that. So Daisy, if you wouldn't mind heading over to the next slide, please. Awesome. So whenever you are experiencing emotional or mental distress, it's important to know that you are not alone. Experience intense emotions, especially in reaction to the COVID-19 pandemic, is natural. And mental health resources are available to help healthcare workers and healthcare students like you. And sometimes just having someone to listen helps. Other times, having professional mental health support is essential. And just because you can't speak with someone face to face doesn't mean you can't access support. So there are several free, confidential, and live support services available for healthcare professionals, including the crisis text line, the disaster distress helpline, and the emotional PPE project. Daisy, you can go to the next slide, please. Additionally, healthcare workers and healthcare students can also receive assistance by checking out local resources nearest to them. So, for example, calling helplines like 211 or searching through sites like Aunt Bertha can help you find local mental health resources and really services that fit your unique needs. Head to the next one. Thank you. And lastly, there are several virtual support mobile apps that are available for healthcare students and healthcare professionals, including Happify, Headspace, and Mood Mission. So apps like these are designed to help you engage in mindful activities, or games, or even exercises whenever you're feeling overwhelmed emotionally or mentally. So with that being said, I'll go ahead and turn things over to my colleagues in career advising, Jen and Chelsea, for the next half of the presentation. So take it away.
Hi, everyone. I'm Chelsea, career advisor. I work with healthcare and nursing students. So we just wanted to start off by letting you know a little bit about the resources that are available to you through the department. So we're actually here as a free resource for students and then as a lifetime benefit for alumni too. So once you graduate, should you need assistance 10, 20 years down the road, we're here. And we can help with things like job search strategies, resume, cover letter reviews, interview prep, networking techniques. I mean, really whatever we can do along the way to help you to be the best candidate that you can be, we're here for that. We frequently hold virtual events similar to this one via Handshake, so career fairs, employer spotlights, networking sessions. So Handshake is a great thing that you can be using too. And really, regardless of where you are in your career or your job search, there's something that we can all be kind of working on all the time behind the scenes. Again, to continue to make us the best candidates that we can be. So you can always call in and speak with a career advisor or email us or go to the career page too via my SNHU. So we're here and we're happy to help. I'll pass it over to Jen.
Thanks, Chelsea. My name is Jen, and I also work as a career advisor for the nursing and healthcare professions. The next part of the presentation is all about best practices to help you break into the healthcare field. As a career advisor, here are some tried and true tips that our students have used to successfully land a job. Let's first tackle healthcare industry associations. There are so many benefits to joining industry-specific associations, everything ranging from networking to professional development, which could potentially lead to a job opportunity. Be sure once you do register to attend their membership meetings, networking events, and conferences if you can. Try to join while you are a student because most offer a student membership at a discount. Chelsea, if you don't mind including those links, perfect, thank you. Next slide. Thank you. Update your resume regularly. I like to think that a resume is a living, breathing document, so update it as often as you can. So when should you do this? Update it when you learn a new skill, you've obtained a certification, received an award at work or at school, you got that job promotion, you led a special project, you joined an association, and so on. So that way, by the time you do graduate, you won't have to recall every single thing that you have done and would only need to do some minor tweaks before you apply. And the next thing is to tailor your resume to those job leads. If I leave you with anything today, this is so important. A tailored resume helps an employer to see how you are fit for that position. It's kind of like connecting the dots for recruiters and hiring managers who are overwhelmed by a flood of applicants. You have a better chance of getting more views on your resume if you actually customize it to the job description. Another resource that we have in the career department is JobScan, which actually helps pinpoint those missing keywords that were found on the job description but was not stated on your resume. The next thing that I want to share with you guys is research your potential careers. Whether you are about to graduate or if you're starting your program, it's always best practice to research now. There are tons of reputable websites where you can find career-specific information, but my personal favorites are the Bureau of Labor Statistics and ONET. Chelsea, if you don't mind including those links as well in the chat. Some other suggestions are to reach out to your network. Typically, associations have a career-related specific section. Also, conduct informational interviews with industry professionals, job shadowing, or maybe even volunteer. Next slide, Daisy. Networking, utilizing LinkedIn and Handshake. A couple of tips to best utilize LinkedIn as a student is to make sure that your profile is engaging. Use your profile about section to tell a story why you are passionate about the healthcare field or why do you want to pursue the healthcare field. Be sure to follow healthcare facilities, healthcare systems, hospitals that you would like to work for because on your timeline, they'll post up new job opportunities, events, and job fairs. Also, begin building your network now by connecting with former coworkers, supervisors, classmates, and instructors. Now for Handshake, it's actually our online job database with post volunteer opportunities, full-time, part-time, internship opportunities from across the country. Rest assured that just not posted jobs in New Hampshire, but from coast to coast. Employers in the system are specifically looking for new students and alumni, but be mindful that not every employer that's on there is an employer partner. However, both are great networking tools where you can find job postings, events, connect with professionals, alumni, and recruiters. Alternative networking ideas. To supplement utilizing those two platforms and joining associations, consider using your social media. Let your family, friends, and past coworkers know that you are seeking work. You just never know who your folks are connected to. If you're going on a doctor's appointment, well, bring your resume too and drop it off at the front desk, drop it off to the office manager or someone in HR. Just don't forget to grab their business card at the end so that way you can follow up with them. Now, I know that most of you guys, of course, are working full time. Y'all are going to school, y'all taking care of family. Who has time to job search every day? So one time management tip is to actually save job alerts on your most used job search sites like LinkedIn, Career Builder, Monster, even Handshake. You can set up job alerts. Just simply put in the criteria such as the job title, the zip code, and just save. Any postings that match that will be automatically sent to your inbox. Another tip is to try to create an email account specifically for job leads so that way it won't clog your personal inbox. Daisy, next slide. Nursing home administrators and administrative fellowship. These are great positions if you're looking to eventually become a healthcare executive or a healthcare manager in the future. So at times, students do inquire about how to become a nursing home administrator. Well, you would just need to complete an administrator and training program in order to sit for your license. Each state's requirement differ, but typically you would need to complete a certain number of hours at an approved preceptor site. I highly recommend reaching out to your state's Nursing Board Association or Long-Term Care Association to see if they have a list of approved preceptor sites. If you're having trouble, the ACHCA has an AIT inquiry form that is shared with their pool of administrators. Now, for the administrative fellowships, it's also another unique way to get into healthcare. The fellowship provides future healthcare executives with opportunity to gain hands-on and in-depth understanding of hospital and health system administration. It's kind of like a manager in training program where you rotate through each hospital administrative department. Typically, for those roles, you would need to have a master's in healthcare administration, a master's in business administration, or a master's in public health administration to apply. If you're interested in those roles, be sure to check the hospital website early because they tend to accept new fellows once a year. I'll also include the links for the directory, the administrative training inquiry form, and the AIT resources by state in the chat. Back to you, Chelsea.
Thanks, Jen. Great points. Yeah, so I mean, now that we're well into 2022, right, and things seem to be heading in the right direction, hopefully, knock on wood. There's lots that we can do, right, in addition to the things that Jen just mentioned. So I think it's important to just be open to different opportunities, keep an open mind, maybe things you didn't consider before, like short-term or part-time work. Definitely think about your story. Like, what is the story that you want to tell employers? How will you speak to any resume gaps that you might have? Or, were you a stay-at-home parent or a full-time student? Those are things that we can add, to your resume, and you can speak further about those pieces to figure out, okay, here's the story that I want this employer to know about why I'm a great candidate for this role. Definitely be prepared for all things virtual. I think that we're already pretty much there. So virtual interviews and trainings and just communicating in a virtual world, and maybe a position that's entirely remote as well. You can also consider upskilling. Again, at any point, whether you're employed now or looking for work, what are some skills that you're seeing listed on job postings that you might not be familiar with? Are you seeing common themes? Can you build on those skills, take classes, go for certifications, learn different softwares or platforms? And then definitely just be flexible and adaptable. These are skills that employers look for, and it'll help to make your life easier too, right? So their life and yours. And then kind of like Daisy was saying too, that self-compassion piece, just give yourself a break, try not to worry too much and cut yourself some slack because, it can be tough. They say that looking for a job is a full-time job, and that's a cliche, but it's true. It's a lot of work, and just do the best you can. So next slide, please. So again, keep busy, right? Whether we're employed or looking for work, you should always kind of still be thinking about that job search, I think. Thinking about what is your next move? How are you going to advance and grow? So just again, practice, right? Find a buddy, see if they're willing to help you. Maybe practice a Zoom interview or getting comfortable in that remote world. Prepare, definitely. You're always researching, learning, exploring, again, building those skills. Learn what you can too about different employers. Start thinking about who would you like to work for. Maybe they have a really great culture that you've heard about, or you really just identify with their mission or their vision. Research trends in your field, what's kind of happening. Brand yourself for sure. Again, if you're working, continue adding those skills that you're enhancing each day on your daily work. Add them to your resume, practice your cover letter writing skills, continue updating your LinkedIn profile. Just kind of take the time to make sure that you're representing yourself in a polished and positive way, both online and then with your documents, so that if your ideal job does pop up tomorrow, you're ready to go. And then like Jen mentioned as well, networking. So connecting with people everywhere you go. You never know who knows who. So networking is key. Just get used to chatting with people, whether it's at the grocery store, or the pharmacy, the dog park, wherever you go, just chat with people. Get comfortable with it too. Not only for connection purposes, maybe you meet a friend, maybe you just get more comfortable chatting if it's not, your favorite thing to do. So that's that. Again, career services, we're here, to help you to be the best candidate that you can be. So please let us know whatever we can do to help. I'll put, let's see here. I have a couple of resources to add, and then I'll put our phone number and our email address in the chat. Pass it back over to Daisy for this poll.
Perfect. Thank you, Chelsea. And I'll say too, if I don't remember to mention it again, but as a follow-up, all of these resources in the chat, I'll be emailing out to everyone. So feel free to grab them now, but there'll be an email later. So don't worry if you miss them. But as far as this final poll, if you can go ahead and answer this one as well. I know I've already mentioned I use Oak, for instance, in the chat. So just go ahead and let us know. And I believe that I have it set up. Nope, I don't. Okay, never mind. I like this. You guys sound like fun people, listening to music, taking walks. Fantastic. Well, I'll leave this open. Okay, let's see. So yeah, apps, music, perfect. I love it. Yeah, you guys sound like fun people. So with that, I'm actually going to go ahead and pass it back over to Tori really quick. We're going to kind of go ahead and close it up a little bit. We've got some contact information to share with you all as well, and then we'll have time for questions. So Tori, if you want to go ahead and take it away.
Awesome, thank you. Okay, so sticking with the similar theme as before, this will be a little bit more of like a reflection, exercise, guided meditation again. So again, just do what feels right to you. But I love that poll that they just put up because those are all different ways that we can all meditate, right? There's moving meditation, there's listening to music. That's a way that people can kind of become in tune with themselves. So there's so many different ways to kind of come back to yourself, as I like to call it. So if closing your eyes before worked well for you, I will invite you to do the same. And wherever you are, just start to come into the breath, your inhales and exhales. Even if you went that whole presentation without tuning into your breath, that's okay. That's why we're doing this now. And no control of the breath, just to follow its natural state, inhales and exhales. And this is where we want to just let go of everything that we kind of just learned and ingested. We're going to come back to it, right? Because we just want to understand how we feel right now, right? Maybe there's still questions that we have to ask or things that we're wondering, and that's okay. We're going to do a little bit more breath work with this one to close it out. And it's Friday, it's almost the weekend. So as you inhale, I want you to think of filling the belly first, then letting the breath move up into your chest, into your throat, and then you are going to let the exhale go down in the opposite way. So first letting go the breath in the throat, traveling down to the chest, and then letting the belly fall. So inhale through your belly, diaphragmic breathing. Expanding your rib cage from side to side, moving it up into your chest, into your throat, and then exhale to the mouth. Just let it all go. So it's kind of like this ocean wave of breath, as I like to call it. So if it's helpful for you to visualize, the wave kind of coming in and out, then go for it. So just going in and out, inhale, letting the breath rise, and then exhale, letting it fall. Good, so continue that breath. And as you're breathing, I will give you a few questions that you can take away with you after this presentation. So with that last poll that was just asked, if this is something that you're not doing, right? Like you're not sure what to do for your mental health or other ways to kind of come back in tune with yourself, then maybe this is time to do so and try new things, right? So maybe taking something from that poll or something else you've wanted to try and maybe make a goal of it this weekend or next week to just go and do it, right? And see how it makes you feel. Ask yourself if after this presentation, if there are any other questions that you have that you want to be answered. It's always important to write those down, and we will do our best to get those answers for you, right? And then what did you learn, right? I love that question. So with every presentation, every experience journey that we have, we're always learning. We're lifelong learners. So what was it from this presentation that you learned? Maybe there's multiple things. Right? Just continuing our breath throughout these reflections. Good. And then simply, how do you feel? Right. And that's more of a question for yourself. Just ask yourself, how am I feeling from the beginning, the middle to the end now? Right. And hopefully, with taking a few minutes to yourself, you feel a little more calm, a little more energized, a little bit more ready for the rest of your day. Or at least if there are challenging things coming up for you, that you feel more adept and equipped to go through with them, right? And to handle them, because you are capable. So let's continue to go back into those long inhales and exhales if you've lost it. But in these last 3 breaths that we're going to take together, let's make them really long and really deep. So inhale. Exhale, let it go. This next inhale, maybe you count to 4 or 5. And this exhale, count to 6 or 7. Let it go out nice and slow. That extra second or 2 is really going to calm our nervous system, kind of communicates to our nervous system. Good. Inhale to the count of 4 or 5. Exhale to the count of 6 or 7. Awesome. So you can continue to keep your eyes closed if that feels good for you, or you can very slowly start to open them. Let the light back in. I want to thank you so much for joining us on this presentation. We hope it was helpful for you. And I think in the next slide, there is contact information if you'd like to reach out to us. Yes, there it is. So again, thank you so much. We hope you guys have a wonderful rest of your day and a beautiful weekend.
Thank you, Tori. I really love those few minutes. I should make more of a habit of that throughout my day. So I appreciate that time. If there are any questions, you are welcome to put them in the chat. We do have a couple of minutes for questions. And I do actually have one, and it's kind of a big question. So if the answer is it depends, that's fine. But for our career advisors, actually I was going to stop sharing. I'm sorry. For our career advisors, if we have a student who is maybe new to a position, like they've just gotten in, and they have a mental health condition that they want to disclose to their employer, at what point in the process do you feel like is that needed? Is it appropriate? What would be your recommendations for that?
I honestly wouldn't disclose that unless it's imperative for the job itself. So if you're going to need
Okay.
special requirements in order to do your job, then yes, I would disclose it with the employer.
Okay. Wait, like at the time of interview or once you're...
at the time of interview. Yes, sorry.
Okay. No, you're fine. You're fine. Like I said, it was a big question. So I know it's kind of a big answer too.
Yeah.
Perfect. Thank you. I can give it a few minutes. I don't know, Alyssa, do you have any questions perhaps? Not to put you on the spot, I'm sorry.
No, you're totally fine. I mean, I think if anything, the information was provided was extremely thorough and helpful. So I hoped again for all those who are in attendance today, as Tori had mentioned, or what did you learn today? Hopefully you did learn something new that you didn't know. And as always, we here at SNHU are here to support you, and that includes your mental health as well as your career journeys, whatever those may look like. Each individual is different and each individual may need something else than the next person next to them. So just know that as a university, we are here to support you. And you can always reach out to us if you need assistance or just have general questions. So, and also no pressure if you have no questions for today, but if you think of something that comes up, you're like, oh shoot, I would have loved to have heard the answer to that or want to get that question answered. I should have asked it. No worries. Again, our contact information is also here in the chat. So you can always call us, you can always email us as well, and we'll be happy to assist you. So I think that was it for me.
Perfect. I completely agree. So there is a question about how often these events happen. It really depends. So this one is this is the last session of a healthcare themed week that we did. So it depends. I would definitely keep an eye on Handshake for any upcoming events. And I would say too, if you have an event that you want to see, you're welcome to also email it in as well. If you have suggestions for something you'd like to see, please let us know. And that way we can know that maybe we should do this more often. Yeah, Handshake, perfect. Awesome. Well, yeah, like Alyssa said, no pressure today. You're always welcome to email us. I'm happy to give everyone a couple minutes back on their day. So again, just to wrap up, I will be emailing out all of the resources that were in the chat. Those will be emailed out as a follow-up as well, along with the recordings. I'd probably expect to see that Monday or Tuesday sometime. It'll depend. But with that, I hope everyone has a great rest of their day and a great weekend. And we appreciate everyone being here today.
Thank you.
Thanks, y'all.
Thanks, everyone.
Have a good one. Bye, everybody.
Bye.